Hi, my name is Krystal Brassington. Here I have Travis with me doing assignment 1 nur345.
Can you tell me about a time where you recognised adverse changes in your patient's condition and how you responded?
Okay. As a nurse, I pride myself on always providing excellent nursing care. I have found that clinical knowledge and the gut feeling have assisted me in assessing and recognising adverse changes and deteriorating patients. I had provided care for a patient for 3 days that had an IDC in situ. Gradually, urine had decreased. On the 3rd day, I had escalated my concern to the junior medical officer and the RN in charge. IV fluids were commenced and a fluid balance chart attended. On return the following day, the patient was confused, not orientated to place and time, speaking non-coherent sentences. I alerted the team and the family, performed a urinalysis and sent an MSU off to rule out a UTI. Results returned and showed a UTI. IV antibiotics were commenced. Family and patient were both informed. After 24 hours, the patient was less confused and was downgraded to oral antibiotics. Prior to discharge, the IDC was removed.
What is work, health and safety? And can you give me an example of your application of work, health, safety in clinical practice?
Okay. As a worker, we have a duty of care to protect the health and safety of each individual in the business. Work Health and Safety Acts provide a framework that helps facilitate and protect the health and safety of welfare of all individuals in the workplace. As a nurse, we have mandatory training in manual handling to prevent and reduce injuries to employees and patients. This provides nurses with the correct education to follow these procedures. Policies are in place for correctly lifting our patients using mechanical lifters. It's very important that patients that need assistance have the correct lifting equipment and trained nurses assisting in transferring these patients. Physio will review the patient and will recommend the correct machine for each patient. If the patient improves, physio will reassess and downgrade to another mechanical lifter if needed.
You have a Muslim woman going to theatre for a D&C post-mid-trimester delivery for retained products of conception. As you prepare for her theatre, she refuses to take off her hijab. How would you manage this?
Okay. I endeavour to be cultural safe in the workplace. In this situation, I will respect the patient's wishes. I will explain the infection risk with leaving the hijab on and that to place a hairnet over the top. I will then document in the progress notes and let the anaesthetist nurse and surgeon know. As this lady has already gone through such a difficult situation, making this process less intrusive may help her in her recovery. Asking a social worker to follow up with the patient post-discharge just to make sure she is managing at home and if she needs any follow-up care.
You have a 12-year-old Aboriginal girl from a remote community on the ward with a query appendicitis. The RMO advises that he thinks her appendix is ruptured and that she will need to go to theatre ASAP. Her mother has gone uptown to do her Centrelink, banking and shopping. How do you manage your situation?
Okay. In this situation, respecting culture is essential. As the nurse providing care for this 12-year-old girl, it is my job to prepare her for surgery. As Mum has gone shopping, we will continue to get in contact, but in this situation, it's an emergency and 2 medical officers can consent this child for surgery as she is under the age. I will explain this procedure to the patient and why it is important to have it done ASAP. I will answer any questions and fill as much paperwork and pre-op checklist out. Have the patient get dressed into theatre clothes. Always having 2 nurses around at this time is essential. informed social worker and an Aboriginal liaison officer so they can sit with the patient while the social worker tries to get in contact with mum. When mum finally does arrive, the nurse and the Aboriginal liaison officer and the social worker can sit down and explain the emergency of her daughter's theatre case, and we could not get in contact with her, and the doctors had consented her daughter for surgery.
The border mother of 6-month-old admitted to the ward with pneumonia returns to the ward after an evening off the ward. She appears to be intoxicated as she has intoxicate and smells of alcohol. She picks up her son and starts breastfeeding him. When you approach, she asks for some sandwiches to eat as she has not had any dinner. How would you manage this situation?
Okay, in this situation, without being judgmental, I would make sure that mother is sitting down in a safe environment, bub is safe and feeding correctly. I will then provide mum with some sandwiches and a cup of tea, making sure there is also water provided that is in reach of mum. When mum is feeling better, providing a social worker to speak with her in case she has any issues at home, or she may have an alcohol problem which she may be having trouble managing. This may help provide a safe discharge when bub is being discharged. Being mindful, we have to be not judgmental. Thank you. Thank you, Travis,